14 years ago, I began working and training in women's services as a board-certified clinical chaplain. That training involved 1,600 hours of supervised didactic and clinical work. I was the chaplain on women's services in labor and delivery, postpartum, and nursery, and women's surgery for 7 years. And the years since, I've supported and worked alongside the obstetricians, the gynecologists, and nurses, and the whole healthcare team. And my work was to work with patients and helping them through very difficult emotional situations and do follow-up work and counseling concerning stress, anxiety, depression, grief, and many other events. I utilize two approaches in addressing the emotional and mental needs that women have in obstetrics and gynecology. The first approach that I use is called client-centered therapy. Client-centered therapy involves helping to make the client feel safe and secure in the therapeutic environment. Once the client feels that safety, that security, 100% acceptance, 100% regard, they feel safe enough to move into authenticity. It's in that authentic environment that the client has the courage and the safety to share their story. I get to hear their story. I get to help them make sense of their story using person-centered therapy. As they share their story, as they experience that safety and authenticity, the brain actually begins to rest, giving the body rest, priming the body for healing and recovery. I also use cognitive behavioral therapy. Cognitive behavioral therapy utilizes the understanding of the cognitive model. The cognitive model is you think, you feel, you do. If you have healthy thinking or healthy beliefs, you're going to have healthy feelings and healthier behavior. If you have unhealthy beliefs about the self or the situation, you're going to have unhealthy feelings and unhealthy behavior. As the client tells their story, and together we take a look at things that they are telling themselves about themselves or their situations. And if we identify together an unhealthy belief, then we zone in on that and work to understand how that unhealthy belief was adopted and how it's being utilized now, and work to replace it with truth and healthy beliefs about the self and the situation. We're installing context into the understanding so that the client can have a durable and long-lasting recovery. These moms-to-be or these brand new moms may worry or be afraid that they're not going to be the moms that they really want to be for their babies. That can be overwhelming. We work to help them understand everything that's going on around them, help them to understand how capable they really are, and reframe their understanding of all of these events. Working to ease these anxieties and just let these people feel their feelings, or let these moms feel their feelings, really allows them to find rest and hope in these really stressful times. In working to validate and normalize their experience, what really happens is the patient begins to trust themselves again, and trust their work, and trust that they will be all that they need to be for their little ones. I love involving partners and family in the therapeutic environment when the client is ready for them to come in. Helping in this recovery of self and this new understanding of their situation and adopting these new beliefs about the self and really be strengthened by the reinforcement of their loved ones. Bringing them into that environment allows for those that love our patients to hear what's going on with them and reaffirm those messages, not only in therapy, but outside and at home and just doing life with them. I love involving families. I love working with families. I love working with couples. And getting to see them grow together in that environment is one of my favorite things that I can do with family. I want the patients out there that might come see me to know that I love doing this. I love seeing hope rediscovered. I love seeing healing. I love seeing recovery. I love seeing people find themselves again and trust themselves again and understand the truth about them. I also want clients to know that I know about stress and anxiety and depression myself. I deal with them myself. I want people to find healing because I've known how desperately I wanted to find healing. I've experienced loss. I'm a recovering addict with 18 years clean and sober. I've been to the bottom. I know how bad things can be, and I know how desperately people need help. And that's why I do this.